Hello, welcome to the physiology of the gastrointestinal tract. My name is Ayman Saik, and I teach GI Physiology as well as Equine Anatomy at Tuskegee University College of Veterinary Medicine. Um, Before I start the lectures, I would like to give you a little background about myself. My name is Ayman Saik. I'm a Jordanian native. I graduated from vet school in Baghdad, Iraq. Then I moved to the States and did a Master of Science at Kansas State University. After that, I did 2 years of rotations and classes, clinical rotations and classes at Purdue University in Indiana. After that, I did an 18-month extended internship at the University of Illinois Urbana-Champaign in equine medicine and surgery. After that, I went to Washington State University to finish my PhD in neuroscience. And now after that, in the year 2000, to be exact, I moved to Alabama to start teaching at Tuskegee, uh, GI Physiology, as I mentioned, and Equine Anatomy. And also I had an active laboratory. My research area is the role of gastrointestinal peptides such as cholecystokinin or CCK and gastrin-releasing peptide or GRP in the control of food intake. Now, before I start lecturing on GI physiology, what I would like to do is two things. First, I would like to draw your attention to the email address that I have at the bottom of the slide. This is my personal email address. Um, Please send questions, comments, you know, anything that you would like to ask about, to inquire about. I'll be more than happy to answer them. And if you have any comments about, the way the slides are going, or, things that needs to be corrected and things like that, you can also send me those, and I'll be more than happy to receive them and answer them as well. The second thing is before I start teaching um, the GI physiology or the physiology of the gastrointestinal tract, what I would like to do is I would like to convince you about the importance of this topic. Usually, what I tell my students is always when you read, ask yourself this question: why would I care? I mean, yes, there's a lot of information out there, but why would I care? What is exactly relevant to my clinical career? This is very important. And that is basically what I'm trying to tell you in the next few slides. I'm trying to tell you that studying GI physiology is highly relevant to you studying veterinary medicine. You need to know the physiology of the gastrointestinal tract in order for you to be able to treat gastrointestinal cases and diseases. And so in the next few slides, I'm going to show you very common clinical cases in veterinary medicine that'll convince you that studying GI physiology is highly relevant and important for your careers as clinicians. Now, the first case I would like to show you is canine gastritis. The picture shows an endoscopic appearance of a canine stomach that is inflamed. The white arrow points at a pink tissue, which is a normal tissue. However, the blue arrow points at a darker tissue, sometimes even red in color. this tissue is inflamed. We call that angry looking. This case is pretty common in small animal practices. And if you don't know the physiology of the stomach, you will not be able to understand the pathology that's going on in this case. And so studying GI physiology is highly relevant. Now, if you're doing equine medicine and happen to work in the racetrack, you will encounter a pretty common clinical case in horses, and that is equine gastric ulcer syndrome. We call that EGUS for short. Um, the left hand picture shows a normal stomach, light pinkish tissue on both sides, separated by a darker wall. We call that the separation, the margoplicatus. And then on the right hand side picture, you will see a stomach that is full of ulcerative lesions. Racehorses are pretty competitive, so they have a lot of stress to race and compete and win and things like that, and that's why they get gastric ulcers pretty frequently. If you end up doing bovine medicine and surgery, you will encounter a case that's called left displacement and right displacement of the abomasum. So what this case basically is, it's a relocation of the abomasum to the left hand side of the abdominal cavity rather than staying on the right hand side where it normally is. So the left hand side picture shows the stomach of the cow, which consists of 4 compartments: omasum, abomasum, reticulum, and rumen. The rumen is basically what you see in most of the picture, the left hand side picture. Now, the very far end of the picture, which is the very far left of the picture, is the reticulum, and you can see the esophagus coming from there. So you have the esophagus, you have the reticulum, and you have the rumen. In the right hand side picture, you will see the reticulum and the esophagus and the rumen, but also you will see this bluish structure or compartment, which is the abomasum. This abomasum immigrated from the right hand side of the abdominal cavity to the left hand side of the abdominal cavity. And so the right picture shows a left displacement of the abomasum. This case causes a number of biochemical changes in the blood of the bovine patient. We study the physiology so we can see the normal values of those electrolytes. Now, when you have this case, all of these normal values will be abnormal, and that will be part of your diagnosis, is when you see these laboratory values changing. So this is a very, very important thing to understand and appreciate. You have to appreciate the normal, which is the physiology, in order for you to learn the abnormal or the pathology, so you can diagnose and treat the case. Small intestinal tumors are common in small animals. These are incidental findings sometimes. You open the abdomen, you want to do a spay or a neuter and things like that. Pretty simple procedure. You look at the intestine and you can see number of growths. You have to understand why these growths took place in certain places, and more importantly, what do they do to the normal gut functions, the motility, what happened to food when they pass through this part of the intestine, what happened to the blood supply of that part of the intestine, and things like that. So we have to understand the physiology, the normal, in order for us to appreciate the abnormal, which is this case. In both animals and humans, there is a very, very important case that's called colorectal cancer, a cancer that grows in the colon and in the rectum of the patient. And so, as this is an endoscopic picture that shows this lesion, in the middle of the picture is the tumor, and the rest of the picture is basically the colon, the endoscopic appearance of the colon during colonoscopy. Now, if you don't know the physiology of the colon and the rectum and what do they do and how do they store the food and how the food gets expelled from the rectum to the anus during defecation, you will not be able to appreciate the signs that this colorectal cancer will produce. So you'll be presented with a patient that has difficulty defecating, meaning constipation, bleeding during defecation, abdominal pain, colic, things like that. And if you don't know the normal, you will not be able to understand what is going on in this case. So that is another reason to understand gastrointestinal physiology. Now, I've presented you with a number of clinical cases, pretty common clinical cases that you will see in your practice, all the way from gastritis to ulcer to LDA to incidental tumors in the small intestine to tumors in the large intestine. All of these demonstrate to you that studying and understanding gastrointestinal physiology is essential for you as a clinician. There is a saying also that says a good anatomist is a good surgeon, a good physiologist is a good internist. In order for you to understand the disease and how it happens, you have to understand the physiology. It is critical to understand the physiology. So I hope at the conclusion of these 4 or 5 slides, I convinced you that studying GI physiology is clinically relevant. And you will see that later on when we talk about the different parts of the gut and the different problems that each of these parts encounter. Okay. So what's my goal from teaching GI physiology? What I hope to do is to build your background, give you a solid background in gastrointestinal physiology in order for you to utilize it later on to understand the clinical cases associated with the gastrointestinal tract. We call that clinical gastroenterology. So my goal is to build your background in the normal so you will be able to understand and treat the abnormal successfully. This is the main goal from these lectures. To do that, I've decided to divide GI physiology into two parts. A general part, and I'll tell you exactly what I mean by general part. We'll talk about definition, we'll talk about what is the GI tract, we'll talk about the different parts and portions of the GI tract and the different histological layers that makes the GI tract and things like that. And then I will take you to special GI physiology, and in that part I will teach you the specific functions for the GI tract. For example, motility. For example, digestion. For example, absorption. For example, secretion. All of these are special functions for the gastrointestinal tract. So, in order to build a background in GI physiology, I've divided the topic into two parts: general GI physiology and then special GI physiology. In the general GI physiology, I will talk about 4 points. We will define the gastrointestinal tract. What is the gastrointestinal tract? What does it do? Then we will talk about the divisions of the gastrointestinal tract, the different parts of the gastrointestinal tract. Then we will put the gastrointestinal tract under the microscope, and we will look at the different layers that form the gut. And finally, I will talk about the control systems that orchestrates or organize the different functions of the gut, meaning that I will be talking about the different mechanisms that regulate the different functions of the gastrointestinal tract. What regulates digestion? What regulates motility? What regulates secretion? What regulates absorption? All of these mechanisms are control systems that orchestrates, and I use the word orchestrates like an orchestra. You see how the orchestra plays in harmony together to produce a beautiful, beautiful, beautiful piece of music. The same thing with the gastrointestinal tract. Different systems regulate, organize, orchestrates the different functions of the gut in order for you to get the most out of the food that you eat and then expel the rest outside your body. And so these 4 topics we will be talking about: the definition of the gastrointestinal tract, the divisions of the gastrointestinal tract, the histology of the gastrointestinal tract, and the control systems of the gastrointestinal tract. So let's start now by defining the gut, defining the gastrointestinal tract. The definition of the gastrointestinal tract is the following: the GI tract is a tube-like structure that extends from the mouth to the anus and supplies the body, including itself, with nutrients, water, and electrolytes by performing 4 different functions. What are these functions? Digestion, absorption, secretion, and finally motility. So the gut is a tube-like structure that goes from the mouth to the anus and provides the body with nutrients and water and electrolytes through performing four different functions. First, it digests the food, then it absorbs the food, then it performs a number of secretory mechanisms, then and during all of these functions, the gut is moving from one part to the other, meaning that the ingesta in the gut is moving from one part to the other. Not the gut itself is moving, but the ingesta inside the gut is moving from one part of the gut to the other, because each of the parts of the gut is specialized in certain functions. And for you to have more digestion, you have to have the food present mostly in the stomach and in the small intestine. However, if you want more absorption to take place, then the food has to be more in the small intestine. Secretion happens or takes place all over the gastrointestinal tract, and motility also happens all over the gastrointestinal tract. And so the definition of the gut is extremely important, and it summarizes what we need to learn. A tube-like structure that extends from the mouth to the anus. So we need to understand the different parts of the tube all the way from the mouth to the anus. And I'll show you the next slide. What do I mean by that? The different parts of the gastrointestinal tract. Then we will study in special physiology the different functions of the gastrointestinal tract, such as digestion, absorption, secretion, and motility, that through these functions, the gut will provide the body, including itself, with nutrients, water, and electrolytes. Okay, this slide shows the different parts of the gastrointestinal tract, all the way from the mouth to the anus. After the mouth, you have the esophagus, then you have the stomach, then you have the small intestine, which comprises of duodenum, jejunum, and ileum. Then comes the large intestine, which consists of cecum, colon, and rectum. So the gastrointestinal tract is a tube-like structure that extends from the mouth to the anus and supplies the body, including itself, with nutrients, electrolytes, and water by performing four functions: digestion, absorption, secretion, and motility. And here we see the different parts of this tube-like structure. First, the mouth, which is not shown in this picture. Then you have the esophagus, you have the stomach, then the small intestine, which consists of duodenum, jejunum, and ileum. Then comes the large intestine, which consists of cecum, colon, and rectum. And, and here I would like to draw your attention to a very important point, and that is the gastrointestinal tract is different than the digestive system. The digestive system is the gastrointestinal tract plus the digestive glands, which are the liver and the pancreas. So the gut or the gastrointestinal tract is only the tube-like structure. The digestive system is the tube-like structure plus liver and pancreas. It's very important to distinguish between the gastrointestinal tract, a tract, and the digestive system. Okay. So now we've defined the gastrointestinal tract. We looked at the morphological compartments of this tract. Now let's take a look under the microscope and see what are the layers that form the wall of the gastrointestinal tract. If I take a piece of that tube, which we call gut, how does it look under the microscope? Now, if we take a look at the different layers of the gastrointestinal tract wall, we will find that the gut consists of 4 layers: mucosa, submucosa, muscle layers, and serosa. Now, this picture shows each of these layers. From the lumen of the gut, from the inside of the gut to the outside of the gut, these layers are: the first one is mucosa, which consists of 3 different layers: an epithelial layer, which consists of enterocytes and endocrine cells. Those epithelium have sometimes villi, sometimes they don't have villi. They act like sensors for the different food that enters the gut. This epithelial layer is attached or built on another layer which is called a lamina propria. Underneath that lamina propria, there is another layer which is called muscularis mucosae. All 3 layers make the mucosa. Now, underneath the mucosa is the submucosa, and underneath that is a couple of muscle layers: an inner circular muscle layer and an outer longitudinal muscle layer. The outermost layer in the gut wall is called the serosa. This is the layer that you actually touch when you open the abdominal cavity and start working with the intestine. You touch the serosa. So again, the layers are mucosa, submucosa, muscularis, and serosa. The mucosa consists of three layers: epithelium, lamina propria, and muscularis mucosae. And the muscle layer consists of two muscle layers, an outer longitudinal and an inner circular. The submucosa is a singular, and the serosa is a singular layer as well. Now, between these layers, there are two ganglionated nerve plexuses. Two ganglionated nerve plexuses. These nerve plexuses are the submucosal plexus, located underneath the submucosa, and the myenteric plexus, sandwiched or located between the two muscle layers of the gut wall, the outer longitudinal and the inner circular. Between them, you have the myenteric plexus. Now, the myenteric plexus and the submucosal plexus comprise what we will refer to as the enteric nervous system, or the ENS. So the ENS, or the enteric nervous system, consists of two nerve plexuses: myenteric plexus, located between the two muscle layers of the gut, the outer longitudinal and inner circular, and the submucosal plexus, located under the submucosal layer of the gut. This enteric nervous system, submucosal and myenteric plexuses, control the gut functions independently from the central nervous system. Independently. That's why some people will classify the enteric nervous system as part of the autonomic nervous system. Some will, and some will include it in the peripheral nervous system. Classification is not an issue. The most important thing is that we have to know that there is a brain located in the gut. This brain of the gut we call the enteric nervous system. This enteric nervous system consists of two plexuses, myenteric and submucosal. The myenteric is located between the outer longitudinal muscle layer and the inner circular muscle layer, and the submucosal plexus is located underneath the submucosa. Now, one of you might ask, okay, well, so what? Why do I need to understand all these layers? Are they clinically relevant? What exactly is their clinical relevance to me as a clinician? And this question is pretty legitimate, by the way. And you will appreciate this histology when I present you with a case that's called esophageal achalasia. But before I do that, I want you to remember a few things. The first thing is that the submucosa, or the submucosal layer of the gut, which is the second layer of the gut underneath the mucosa, as this slide shows, is what we call a holding layer, meaning that it's a strong layer, meaning that you don't want to puncture it or injure it or rupture it during surgery, because if you do, that means the contents of the gut will leak to the outside, and they will be in the abdominal cavity, and you will have peritonitis, and you will have devastating outcome. So you don't want to injure that layer. The submucosal layer is a holding, powerful, strong layer. So if you want to work, you need to work with the other layers, number one. And number two, the serosa is pretty important because it's part of the peritoneum. And that's very important because peritonitis is a pretty serious disease and pretty serious infection and pretty serious post-surgical complication. You don't want it to happen. So you have to be very gentle when you hold the intestine, when you handle the intestine, and you have to use lots of fluids and irrigation. So don't break the aseptic technique. So the serosa is pretty important, and the submucosa is pretty important. Now, the rest of the muscle layers, or the rest of the layers, you can actually work with. And we will discuss how these layers can be manipulated surgically in the case of the esophageal esophageal achalasia is basically stenosis of the esophagus before it enters the stomach. Now, the right hand side picture shows an esophagogram, which is basically a radioactive material that the animal or the human drinks, and you take multiple pictures so you can see where the stenosis is. And you can see that on the left hand side picture in the drawing, you can see the stenosis. This case is very important because it's associated with many clinical signs such as respiratory signs, respiratory difficulty, regurgitation, chest pain, etc. And so in order for you to treat it, and that's where the importance of studying the layers of the gastrointestinal tract comes, is you have to do a procedure that's called myotomy. Myotomy is basically cutting through the muscle layers of the gut, or of the esophagus in this case. When you open it, basically you open up the stenotic area and food starts to go easy from the esophagus to the stomach. This surgery is done actually in our lab. This is a photomicrograph of myotomy that's done in our lab. The blue line on the image shows where the cut was done. You should do that, of course, under the surgical microscope. And when you open the muscle layers, you can see basically the different muscle layers, circular muscle and the longitudinal muscles that we severed. Once we open them, as I mentioned earlier, we keep the submucosa intact. We keep the submucosa intact because the submucosa is a holding layer. It's a strong layer. You don't want to injure it because if you do, then you will have leakage, and then leakage of the intestinal contents, and then you will have infection, peritonitis, and things like that. A devastating outcome might reach death, as a matter of fact. And so myotomy, or cutting the muscle layers, is basically a procedure that's done to treat the stenotic area in the esophagus, and it can be done in the intestine or in the esophagus or any part of the gastrointestinal tract. So that's why studying these layers is extremely important from a clinical standpoint. Very important. So back to the definition that we've talked about earlier. What is the gut? I always try to keep this definition handy so we can remember basically what are we studying. What are we talking about? Well, we are talking about the gut, which is a tube-like structure that extends from the mouth to the anus and supplies the body, including itself, with nutrients, water, and electrolytes by performing four functions. And they are highlighted here in yellow: digestion, absorption, secretion, and motility. So this tube supplies the body with nutrients and electrolytes and water by performing four functions: digestion, absorption, secretion, and motility. Now the question becomes, how would these functions work together? Orchestrate or orchestration of these functions is a must, because I don't think any of you would like to have a burger and go to the bathroom at the same time. So you basically eat it from here and go to the bathroom in the next 2 minutes. Or a nice meal and vomit it at the exact same time. I mean, it doesn't work this way. So you have to digest it first, absorb it, and secrete stuff on it so it can be dissolved. And all of this happen when the gut moves it from one place to the other. And you remember that we've talked about the parts of the gut: esophagus, stomach, small intestine, which includes duodenum, jejunum, and ileum, and large intestine, which includes cecum, colon, and rectum. So we need a system that orchestrates, that organizes these functions, so we can get the most out of the food that we eat. We get the most nutrients out of it. We get the most water, the most electrolytes. So how does that happen? What orchestrates those functions? Okay, well, we have a control system that orchestrates these functions. The control system of the gastrointestinal functions is divided into two parts. The control system that orchestrates the various functions of the gastrointestinal tract is divided into two parts. The first part is located inside the wall of the gastrointestinal tract. The other part is located outside the gastrointestinal tract. We call the one that's located inside the gastrointestinal tract intrinsic system, and we call the one that's located outside the gastrointestinal tract extrinsic. So we have an intrinsic control system and we have an extrinsic control system. Each of these systems consists of nerves and endocrine secretions. The intrinsic consists of nerves and endocrine secretions, and the extrinsic consists of nerves and endocrine secretions. The nerves of the intrinsic is the enteric nervous system. We've talked about it just a second ago, and we will talk about it extensively later on. And the endocrine secretions from the intrinsic, from the endocrine cells of the gastrointestinal tract, secretes 5 different hormones: secretin, gastrin, CCK, gastric inhibitory peptide, and motilin. This is the intrinsic control system of the gut. Consists of nerves and endocrine secretions. The extrinsic also consists of nerves and endocrine secretions. Nerves of the extrinsic inner systems of the gut consist of the vagus and the splanchnic nerves. The vagus mostly parasympathetic, the splanchnic nerve is sympathetic. And then endocrine secretion, which basically includes the hormone aldosterone, which we're not going to be talking about it here because it's going to be covered in the urinary system and the kidneys. So again, the control system that orchestrates the functions of the gut, the digestion, absorption, secretion, and motility, to perform to their maximum ability. So the gut can give the body and itself nutrients, water, and electrolytes. This control system consists of two systems. We divided it so we can understand it better into two systems. One that's located inside the gut wall, we call that intrinsic, and one that's located outside the gut wall, and we call that extrinsic. Each one of these systems, intrinsic and the intrinsic, consists of nerves and endocrine secretions. The nerves of the intrinsic we call the enteric nervous system, or the ENS, and the endocrine secretions have 5 different hormones: secretin, gastrin, cholecystokinin, gastric inhibitory peptide, and motilin. The nerves of the extrinsic control systems of the gut are basically the vagus, the parasympathetic mostly, and the splanchnic, which is sympathetic. And the endocrine secretion is aldosterone. Now, we will start next by studying first the enteric nervous system. So we will take each of these parts and we will study them independently so we can understand how do they control the different functions of the gut, the different 4 functions of the gut: digestion, absorption, secretion, and motility. How does these control systems orchestrate these functions so you cannot eat and go to the bathroom at the same time? So you can eat, digest, absorb, and then throw the waste outside. Next, we will be talking about the enteric nervous system.